As the coronavirus continues to hit countries all around the world, we wanted to look at some of the trends and underreported stories, things that matter because this is, after all, a global pandemic. And what happens outside these borders will have an impact on the US. As you heard from the CDC, the coronavirus, even if it gets tamped down in the months ahead, could return in the fall. One big portion of that is if it continues to spread around the world and possibly come back to the United States. We want to speak now to Gayle Smith. She's the president and the CEO of the One Campaign. Before that, she served many presidents, most recently President Obama on global development, and has a lot of experience dealing with the outbreak of lethal diseases like Ebola. Gayle, thank you so much for joining us.
Thanks for having me.
As you can see, I'm working from home, like many people around the country, as are you.
Yep.
And we're all trying to balance this. And I think sometimes it's hard to think of what's happening outside of our own world, our own immediate pain and crisis. But as I just laid out, what happens around the world will matter. If not today, it will matter tomorrow. Can you explain what you at One are focusing on? What is the biggest area of concern for you?
Well, Margaret, as you rightly said, it's a global pandemic. So we've got to think about this globally, even while, and understandably, people are focused on the situation in their own neighborhoods, their own communities, and their own countries, because it's hitting us everywhere. But the fact of the matter is that this virus doesn't need a passport or a visa, and it's moved freely around the world. We've seen it move from Asia to Europe to North America. It's now increasing its spread across Africa, Latin America, and parts of Southeast Asia. So it's indeed global, and it's very, very mobile. And what we're concerned about is that the same way we see in the United States, for example, that this pandemic strikes the hardest at people who have the fewest things to fall back on. The same is true for countries. So our focus of a new campaign we're running called One World is on Africa and the impact of the virus and the pandemic there. And I think my main concern is that, again, while I totally understand the imperative of leaders to be focused on the countries they lead, it's equally important that they focus on the spread of this pandemic around the globe, because it can come back, it can be re-imported, and we could end up in a vicious cycle if we're not looking outside at the same time as we're focusing inside.
You know, I hear these calls for global leadership from the United Nations, from the president of France. We just had King Abdullah of Jordan on the program issuing this call as well. And I guess the question is, who's in charge here? What does global response actually mean?
Well, global response can basically come from a couple of places. One is the United Nations system. Now, we've seen in the last few years there's been perhaps less utilization of the UN than there has been in the past, but it's a critically important organization because we're all members of it. And the technical organizations like the World Health Organization, the World Food Program, which is now providing the logistical support for the provision of a lot of things around the world. So that's number one. The second is the global financial institutions, which are playing a key role, the International Monetary Fund and the World Bank, because we're seeing, on top of the pandemic, a global economic crisis. And the third is, if you will, coalitions of the willing. During the Ebola crisis, for example, President Obama took a number of steps, including a summit at the UN with the then Secretary General, getting on the phone with other leaders around the world and pulling them together on a very regular basis to make sure that we from the outside were providing as much as we possibly could to defeat the Ebola epidemic inside West Africa.
When you have, as we're seeing right now, an argument over funding of international organizations, specifically the World Health Organization, does that hurt the ability to respond? Or are agencies like the WHO still able to do these things? Because we hear from the Trump administration that even if the US freezes funding, they'll still provide aid, and they'll just do it directly to the organizations on the ground who were actually doing the work in the first place.
WHO is providing assistance all over the world as well as guidance. And, you know, my experience, again, coming from the Ebola epidemic, which was 14 months of not doing anything but Ebola 24/7 because of the extreme urgency of that crisis, is that issues as to the WHO, if there are views that the WHO has not performed in the right way, that's something to look at after we get through this. There should be a after action looking at all international institutions and countries, in fact, because the world has not done as good a job as it should do, certainly in the future, in the face of this threat. For the time being, these organizations are relied on by many people around the world, particularly in Africa and Asia and Latin America. And they do provide guidance. Now, they're not the only ones. There are non-governmental organizations out there on the ground, both local and international, that are very, very vital. But what's also key is that there be coordination, because an ad hoc fragmented response is going to give the virus time to move. It's inefficient. And it's not as impactful as one that is driving with a real strategy that brings everybody into the same room to do a division of labor and go after this virus as effectively as we can.
We hear Australia and the United States are united in really pushing for an investigation, focusing on what China did or didn't do, and they want to bring that case to the WHO. This seems just like a diplomatic, bureaucratic argument. I cover those things and have for years, but for your average person, they'd say, who cares? You're saying, it sounds like, those kind of arguments actually can have a real world impact in slowing down the response in these countries where there is the greatest need right now.
Right, and I think during a crisis like this, we need to be squarely and singularly focused on managing crisis. Issues come up, they always do, they will come up. Some of those are based in really egregious behavior, some of those are more political. At a certain level, it doesn't matter. Those need to be put on the side for the moment and return to once we get past the crisis. There may well be lessons learned from the experience of WHO. There's certainly plenty of lessons to be learned so that the world is better prepared next time. But for right now, in the urgency of the moment, anything that diverts our attention from our primary goal, which is ending the pandemic, gives the virus time. So my strong view is, I'm not saying it's relevant or irrelevant, it is something to be addressed once we get through the crisis.
And what is the urgency of the moment when it comes to some of the other diseases and viruses that are still spreading? I mean, does our focus on this emergency divert from other areas of need?
Well, it certainly can. For example, a cut in funding would mean a reduction in funding possibly for the fight against polio, where we're near successful. Importantly, though, Margaret, is that organizations like the Global Fund for AIDS, TB, and Malaria, and Gavi, which is the Global Alliance for Vaccines, are very active now in the COVID response. But also in protecting the gains we've seen in, for example, the vaccination rate of children around the world or the fight against HIV and AIDS. So there's an effort underway to try to do two things at once. But we do need to be mindful that we will probably see globally out of this crisis some net losses in the progress that we've made on other fronts in health and certainly on economic development.
You know, we spoke recently with the King of Jordan, who's got a population, 20% of which is a group of refugees, some of them coming straight out of the Syrian war zone. And he said right now, his approach has been treat everyone equally. And he argued, and the UN backed it up, that there really is no outbreak among the refugee population there. How sustainable is that? I mean, do you see that as indicative of what will happen elsewhere, or is this just a crisis waiting to explode?
I think we've got to assume that the virus can move anywhere at will, and all it needs for transmission is a human body, right? And so I think the chances are very high, and in some cases the facts are already in evidence, that in refugee camps, in internally displaced persons camps, inside a country where you've got highly concentrated, vulnerable populations, we are already seeing or will see the spread of the virus there. Now, if those case levels are low in some cases, that gives us an advantage because you can get ahead of it and put in place the contact tracing and testing that allows us to get ahead of the curve. But I think, frankly, one of the biggest concerns about the spread of this virus globally is for refugees, IDPs, and people in chronic war zones, because those are the areas where it's the hardest to deliver the kind of systemic response that's needed to get ahead of the virus.
If time is of the essence, if you were working on the response in government right now, what would be the thing you would do? I mean, how do you put out this fire that seems to be engulfing the world?
I would return to some of the things I think we were able to do in the case of Ebola. I would certainly urge that the leadership convene other leaders so that we could put together a global response that is strategic, is coherent, and does things like managing some of the global supply chains that we're seeing proving so problematic even in the United States as there's competition for PPE and other goods. The same is true globally. I think global leadership could do a great deal to sort that out. I think second, I would turn to the experts across the federal government and mount a very robust response where we, in support of partners on the ground, I think could be doing a lot to deliver assistance, provide training, ease up on the logistics, and do the kinds of things that my former agency, for example, USAID, is very, very good at doing. And then, Margaret, the last thing I would do is remind people that prior to this pandemic, the world's investment in what we call global health security, or putting in place the ability of countries to prevent, detect, and respond to viral threats, spending was minimal on that. And now is the time, even in the heat of a pandemic, to start building that capacity, because we've got way too many holes in the net. We know from what we've seen over the last 20, 30 years, going to be more viral threats, and now is the time to start building the architecture we need so that we do not repeat what we're going through now.
All right. Yes, thank you for your time. It's a good conversation. Always good to catch up with you.
Always good to see you, Margaret. Thank you.